Good evening, and thank you for joining us tonight. My name is Joe Fuchs. I'm the administrator here at Bucks County Surgical Suites, located right here in Warrington, Pennsylvania. Our facility is located easily accessible from Route 611 and Route 202. In January of this year, we began our Heal from Home total joint replacement surgery program. We had very good success with these program sessions, which we did right here in our lobby. Now, as you're all aware, due to COVID-19 and everything that went along with it, it's forced businesses to make alterations and to move forward. So we're proud to be broadcasting tonight right here from our surgical center. And we're thankful that you have chosen your time to spend with us and hear what our surgeons have to say about our program and our surgery suite. But tonight, we're extremely fortunate to have Dr. Thomas Vicorn and Dr. Charles Burrows with us. Both are specialists in total joint replacement surgery. At this time, I would like to go ahead and turn the mic over to Dr. Vicorn, who will introduce himself, and then he'll forward this over to Dr. Burrows. Dr. Vicorn?
Hi, thanks, Joe. My name's Thomas Vicorn. I'm an orthopedic surgeon. I practice in partnership with Bucks County orthopedic specialists. I've been practicing orthopedics for 10 years and have a subspecialty in total joint replacement surgery and have a specialty interest in outpatient total joint surgery, which is what we're going to be talking about tonight, meaning total joint surgery where the patient can go home the very same day as the procedure. Thanks, Joe.
Hi, I'm Chuck Burrows. I also practice at Bucks County Orthopedic Specialists. I've been practicing in the Doylestown region for over 20 years. My practice is focused on total hip and total knee replacement, and also with a special interest in outpatient joint replacement. Thank you, Joe. Thank you, Thomas.
Thank you, doctors. So folks, our goals for our presentation tonight are as follows. Obviously, we want to help you understand osteoarthritis. What is osteoarthritis and how does it affect your body? What is the Heal at Home difference? Are you a candidate for same-day surgery like the doctors were speaking of? And you do have that option to heal at home in the comfort of your own home. As I mentioned before, prior to COVID-19, we would have done a tour here in the center, a live tour. Unfortunately, things had to change. Although we cannot do that tour in the center in person, we prepared a short video for you to watch so you can have that feeling of what it's like here in our center. And lastly, we'll end the session tonight answering your questions. We're going to do a short question and answer session with the doctors, and hopefully get all your questions answered. You'll have that opportunity to either text in the chat box or on YouTube. So make sure that you get your questions ready to ask the physicians. So at this time, I'm going to hand that microphone over to Dr. Vicorn once again. And Dr. Vicorn will go through osteoarthritis and everything else that you need to know about total joint replacement surgery. Dr. Vicorn?
Thanks, Joe. So basically, when we talk about osteoarthritis, we are talking primarily about just plain wear and tear arthritis. There are different types of arthritis that are more rare, like rheumatoid arthritis or autoimmune types of arthritis. But the vast majority of people who have painful joints, it's from osteoarthritis, which is wear and tear in the joint. And what that means is that the cartilage that covers the end of the joint is worn down, and then the bone is exposed, which is filled with nerve endings, and severe pain develops. So just like if the enamel wore down from your tooth and the nerve was rubbing when you chew food, that would be very painful. Well, it's very similar on the joints. And unfortunately, once the cartilage is worn down, there's not really a way to put new cartilage in, which is why osteoarthritis requires, in most cases, surgical treatment. Let's go to the next slide. So this X-ray depicts a hip with arthritis. So on the patient's right side, which is labeled in red, you can see that there is no space between the ball and the socket, in contrast to the patient's left side, labeled in yellow, where the arrow points to an ample degree of space between the ball and the socket of the hip joint. So looking at this X-ray, I would anticipate the patient that goes along with this X-ray would have extremely severe daily pain with activities of daily living. Okay, next slide. Similarly, this depicts a knee with osteoarthritis. The yellow arrow points to the preserved space in this patient's left knee, and that space is occupied by the cartilage. And then the red arrow points to the complete absence of space between the femur bone and tibia bone on the patient's right knee. And this patient had an injury that started the arthritis process. As you can see, the two metal objects in the bone are screws from an ACL replacement. So this patient tore her ACL at age 18, and then it was repaired, but damage was done that ultimately led to very severe arthritis developing. Okay, next slide. So osteoarthritis treatment starts out with what's called conservative treatment. And what that means is non-surgical treatment. And for this consists of essentially two levels, you might say. So for patients who carry extra weight, one of the most beneficial things is trying to lose weight, because that extra weight adds to the pressure against the joint and the pain that people feel. And a lot of people say, well, isn't exercising doing more damage? But that's not really true. It's non-impact exercise like biking, swimming, elliptical, these types of things can be very beneficial in terms of preserving muscle strength and losing weight, and thereby help people cope with arthritis better. In terms of medical therapy, Tylenol or anti-inflammatories can also be very successful for a mild case of arthritis, where the pain is just starting. Eventually, though, as the cartilage grows thinner, then the pain increases, at which point we oftentimes try injections. So for the knees, we have two types of injection: cortisone, which reduces inflammation and pain, and then what are called lubricant injections. The medical name is viscosupplementation, which adds to the cushioning fluid in the knee and helps people have some relief of pain. In the hips, however, only cortisone is available. The lubricating shots aren't approved for use in the hip. Okay, next slide. So when the pain is no longer being adequately controlled by the conservative treatment of Tylenol, anti-inflammatory injections, that's when joint replacement surgery becomes the patient's best option. These two x-rays depict the appearance of a hip replacement on the left and a knee replacement on the right. And basically what that consists of is recapping the end of the bone so it's no longer rubbing bone against bone, and thereby alleviating the pain. And that's what we're here to talk about today: hip and knee replacement. Okay, next slide. So one of the hallmarks of Bucks County orthopedic surgery as a orthopedic practice has been an extensive focus on joint replacement surgery. And we've had an excellent growth of joint replacement surgery at Bucks County orthopedic specialists, with very low complication rates, leading to several accolades such as a Blue Cross Center of Distinction, Leapfrog Grade A for safety, and a Medicare 5-star rating, which is a very sought after and very difficult to obtain. Medicare only gives a small fraction of joint replacement surgery programs that distinction. And one of the things, because of the constant focus on improvement, has been a decreasing requirement for length of stay in the hospital. So the graph on the right depicts the average length of stay for our hospital-based patients over the past 5 to 10 years. And as you can see, it started out with average patients staying about 3.5 days in the hospital after joint replacement. And over the years, through advances in anesthetic techniques and surgical techniques, that has been decreasing further and further, to the point where, as of approximately 2 years ago, the average patient was only staying overnight. And then, of course, the question is, could your higher performance patients, those patients with good physical capability, do they even need the hospital stay at all? And that is when we really sought to develop a truly go home the same day outpatient total joint replacement surgery program. Next slide, please. So basically, our philosophy is for those patients who are medically healthy, there's no place better than to recover at home after total joint replacement. There's so many advantages. Number one, home offers so much safety in terms of not being around people who could put you at risk for contracting infection. And of course, that's extremely important now with people's concern about coronavirus. And especially since coronavirus is the most dangerous to people in the adult age range. The other benefits of go home the same day surgery are the comfort of being in your own home. And also for many insurance plans, there's a tremendous cost savings if the hospitalization isn't required. Okay, next slide. So basically, we started doing truly go home the same day joint replacement surgery in 2017 and have seen the numbers just go up and up as the years go forward. More and more patients are opting for this approach to have their total joint replacement surgery. And as you can see, it's just a significant increase. And this year, we most likely do probably 350 surgeries with a truly go home the same day approach. Next slide, please. And so after performing many successful go home the same day surgeries in a hospital venue, the next question after that is it safe and is it effective to perform these surgeries in a freestanding joint replacement surgery center? And this is something that is being done more and more across the country, not quite as heavily adopted in Pennsylvania yet, but it's really considered the state of the art when it comes to joint replacement surgery. And the benefits are the safety of a center in which the focus is on joint replacement surgery and all of the surgeries are what we call in surgery clean surgeries, meaning no infection surgeries are done at the venue, thereby leading to studies show lower risk of surgical site infection. So in December of 2018, we started our outpatient total joint replacement surgery program at the freestanding joint replacement center, Bucks County Surgical Suites. Now, just to make sure the terminology is easily understandable, Bucks County Orthopedic Specialists is a group of orthopedic surgeons. Bucks County Surgical Suites is the ambulatory surgery center where the surgeons started a truly outpatient total joint replacement surgery program. Now, in Pennsylvania, as I mentioned, this outpatient freestanding center approach to total joint replacement is fairly novel. And ours was one of the first ones in the entire state of Pennsylvania to achieve credentialing, and the very first one on the eastern half of Pennsylvania. And I'm told that the state considers our program sort of their shining star in terms of safety. So basically, having surgery in the freestanding center, which is what we're talking about tonight, offers people the opportunity to have the surgery in an environment where they get to avoid the risk of hospital-borne pathogens, and there's really no distractions like emergency room and other parts of a complex machine vying for the focus or distracting the focus from the patient. And as I mentioned before, for many patients, it's a much lower cost option. Next slide, please. So basically, the way this works is when a patient comes to the office and we, the surgeons, see them and discuss total joint replacement, we assess whether the patient would be a good candidate for a outpatient or go home the same day approach to surgery. So we look for people that have absence of significant underlying medical conditions. We realize that most people have some medical conditions, but they should be conditions that are being managed in a stable manner, not conditions that are unstable or not being addressed by their doctor. They have to have someone be willing to stay with them for the first 24 hours. And we offer patients an on-site visit to the surgery center so they can learn about our protocols. We also have those extensively provided in written form, which we provide to the patients. And my understanding is that they may be available to people who registered for this session tonight. Next slide, please. Oh, sure enough, there you go. Okay, next slide. So basically, the way a lot of people are incredulous and they don't believe it's possible to have a total joint replacement and go home to your house literally the very same day as the surgery. And this is possible by really tremendous advancements that have occurred in total joint replacement over the past several years, both anesthesia advances as well as surgery advances. Basically, the surgical techniques that we employ have continued to improve over many years, including muscle-sparing approaches to surgery and anesthetic techniques that allow for immediate full weight-bearing ambulation. So, for example, I performed surgery here earlier this morning, and my patients were all up walking literally an hour after surgery. In fact, I believe all 4 of the patients I did surgery on today did a full flight of stairs less than 2 hours after their surgery before going home. Okay, next slide. So rather than read through this whole slide, suffice it to say that basically when we identify someone who desires a go home the same day approach, they should have zero anxiety about the fact that the whole process is going to be laid out for them, and they're going to be partnered with us the whole way so they know what to expect and they never have anxiety about the process. So essentially we identify the patients in the office and make sure we perform exceptional education, medical screening, and very close surveillance after surgery, including nurse and physical therapy that visit the patient in their own house the afternoon of the day of surgery and again the next day. Next slide, please. Our patients have had exceptional feedback about the center. You know, nowadays you can easily go online and read about what people have written about a restaurant or other venues like that. And those patients who choose to look up Bucks County Surgical Suites, you'll see that the feedback from the patients has been unbelievably positive. 100% of the people that have left feedback about their experience have been happy. Primarily focusing on the fact that there are no distractions from focusing on their care in a safe way, and the cleanliness of the facility, which for me as a surgeon, that's just unbelievably important. And the staff here are exceptionally kind and thorough and professional. Just feel really lucky to be able to perform surgery here with such exceptional staff. Okay, next slide. So this is a patient who had surgery about 2 or 3 months ago, and I believe we're going to show a video. Is that right?
This is day 1 after my surgery.
Less than 24 hours.
Less than 24 hours. And as you can see, I'm on a walker. Well, hold on a second. So this is less than 24 hours after, sorry, I got to put this on the ground, after surgery. And well, I'm on a cane. You know what? Forget the cane. So technically, if you have the right physical therapy before you get your hip surgery, you know, you can do the cha-cha. See this? So before, seriously, yeah, it's an 8-inch incision right here. This is anterior. I didn't get it done at Rothman because I didn't want to waste the gas. Right here in Bucks County.
Isn't that posterior?
At the surgical center. Yeah, this is posterior, right. Anterior would have been here. It's up to you, Mike. Good luck.
So I did his preoperative
that patient,
teaching, and the I'm sorry, doctor. The cha-cha was not part of the teaching session when I did that with him. So, Dr. Vicorn, go ahead.
Yeah. So he was a little bit pushing the limits there, but in a good way, and actually had a great recovery. And he was kind of taunting his friend who was considering going somewhere else for the friend's surgery under the belief that he would have a better recovery. And anyway, it was a great story. So let's keep going. So basically, to sum it all up, our Go Home the Same Day replacement program, what we call the Heal at Home program, essentially allows people to completely avoid the hospitalization, avoid the hospital itself, and have their surgery in a freestanding joint replacement surgery center, credentialed by the state of Pennsylvania with an outstanding safety track record, exceptional cleanliness, exceptional outcomes, and patient satisfaction. And for many patients, the cost is a fraction of what it would have been had the patient had the same procedure in a stay in the hospital approach. Okay, next slide. So, Joe, are you going to take back over at this point?
Yes, sir. Thank you, Dr. Vicorn. I appreciate all that great information. Hopefully, folks, Dr. Vicorn answered some of the questions that you may have had. after the tour of the center, we're going to have a question and answer session that we spoke about. Now, if you're interested in contacting the orthopedic office, you can do so at 215-348-7000 or leave an email at contact@bucksortho.com. And one of the schedulers there will be happy to contact you and get you on the books to see one of the fine surgeons over at Bucks County Orthopedic Specialist. Now, without further ado, let's take a tour of the surgery suite. As I mentioned, we did a 2-minute video for you to take a look at our center. And if you have any questions, obviously, afterwards, we'll answer those as well. So let's take a tour of the video or take a tour of the center right now. Hello, my name is Joe Fuchs. I am the administrator here at Bucks County Surgical Suites. We are pleased that you decided to join us for a tour. Let's get started. And once you come into Bucks County Surgical Suites, you'll check in right here at our front desk. One of our friendly staff members will be here to greet you. We're a small facility, only 8,000 square feet. This allows us to provide intimate care for you. We are a lot smaller than that large facility that you're used to, where you get lost in the shuffle. You're in the front door and you're out the back door, and we'll show you that with our tour. We have 2 large, modern operating rooms. Both are larger than 600 square feet. We are licensed by the Pennsylvania Department of Health, and we are nationally accredited by the Joint Commission. Our facility meets or exceeds all of those safety standards you would find in a hospital. And in this area, this is our preoperative and postoperative bay. You'll spend the majority of your time here at Bucks County Surgical Suites in one of these bays. So in addition to our 5 semi-private bays, we also have 2 private bays. Typically, you'll find a pediatric patient or somebody that needs some extra privacy or quiet in this room. Now, conveniently across from these bays, it's our nurses station. We have the friendliest nurses here, and they are waiting to take care of you. During physical therapy, which will be approximately the last hour of your stay, you'll do your physical therapy right here, and when it's time to go home, we will discharge you right out the back door with your family awaiting your arrival. We look forward to providing you exceptional care here at Bucks County Surgical Suites. So here at Bucks County Surgical Suites, as I mentioned in the video, we do meet and exceed all the national and state protocols for a surgical facility. We are a state-of-the-art facility built to the latest FGI guidelines. Now, our air handling systems provide for a linear flow, positive pressure flow in the operating rooms, which allows for the cleanest air to be delivered during your surgery. All contaminants are pushed out. This, along with our high-level disinfection protocols and protocols for our staff hygiene, assist our center with keeping those low infection rates that Dr. Vicorn was speaking of. Now, in response to COVID-19, our center has implemented enhanced procedures, if you will, to further reduce the risk of infection. All staff members, physicians, vendors, they've all been tested for COVID-19. All patients thus far have been tested for COVID-19 prior to entering the facility here. And patients have been scheduled, a little more distant from each other to allow for social distancing. We do not allow any visitors in our waiting area, so your loved ones will be asked to wait either in the car or at home, and we do communicate with them all the time, and we'll have them come in when it's time for them to pick you up. Now, everyone entering the facility is screened as well daily, and this includes direct questions related to COVID and temperatures. In addition, masks are required for everyone that enters into the surgical suite. Now, as we mentioned before, actually, I didn't mention this, but I'm going to mention it now. Next slide, please. Dr. Vicorn was recently interviewed by the Bucks County Courier-Times, and his story was nationally recognized by Becker's ASC, or Ambulatory Surgical Center Review. Now, in this interview, Dr. Vicorn highlighted how the corona pandemic has made outpatient surgery in a freestanding facility even more prevalent than having surgeries done in the hospital. Patients are obviously looking for that alternative setting because nobody honestly wants to be in the hospital where they're treating those patients that may be sick with corona. Now, it is really gratifying to see our program get nationally recognized by a leading healthcare journal like Becker's. Now, let's get your questions answered. As I mentioned before, if you would text your questions into the chat box or onto YouTube, we have operators that are standing by and waiting for your questions. Now, in order to chat, you need to make sure that you go ahead and register. You can do so by entering your name and then just clicking enter, and then you can ask your questions in our chat line. So let's get your questions answered. First question we're going to ask is, Dr. Vicorn, are there any limitations to mobility after surgery? And if so, for how long?
Well, most of the patients are walking approximately 1 hour after the surgery, starting out with a walker and doing a full flight of stairs, well, at least doing some steps, if not a full flight of stairs prior to being discharged home. I usually see most of the patients on a walker for about a week or two, and then a cane for about a week or two, and then going without it. But people are very different. As you saw the patient in the video, some people dispense with the walking aids mere days after surgery. Others feel more comfortable using them for longer, for example, older patients.
Sure, great, thank you. And I think as Dr. Vicorn mentioned, and you can summarize from what he was saying, all patients are different. So Seth was, you know, I didn't teach him to do the cha-cha during his session for preoperative teaching. You know, everyone is different. We always encourage you to keep your hands on your walker or your cane when you're doing your physical therapy, and you know, be as safe as possible. But nonetheless, we did enjoy seeing that video of Seth doing the cha-cha and his exceptional recovery day one there. So thank you, Dr. Vicorn, for that. Now, Dr. Burrows, how long would you say that physical therapy is recommended, or how long would you have your patients go for physical therapy?
Sure. Well, first of all, Joe and Thomas, wanted to thank you guys for just a wonderful presentation that you just delivered on what's happening in outpatient joint replacement. It is a really exciting time. Physical therapy for patients is individualized, and as Joe and Thomas just pointed out, different patients move at different rates. Most patients that come into our center will receive physical therapy within 1 hour of having their operation. They'll be getting out of bed and walking around our center. And then they will often receive physical therapy at home that same day. So in other words, you'll go home, physical therapists will meet you at home and make sure you're capable to get around your home. Make sure you can get up and down stairs. You do not need to set up a bed on your first floor. They also might work at home for a couple more days, and then you'll quickly transition to an outpatient physical therapy regimen. And we have some excellent therapy centers that we've partnered with that can help you get from start to finish quickly without any bother. In terms of the total length of therapy, most patients have finished physical therapy by 4 to 6 weeks, some sooner, some later, but I'd say a month is about average.
Great, thank you. And how about driving? How long is it typical for somebody to have to wait to drive?
Great question. Driving, you really have to think about which joint you're doing, whether it's a right hip or knee or a left hip or knee. Assuming you're driving an automatic, patients who are having the left side done are back to driving quite quickly, sometimes within a week or two, because the left leg doesn't perform much while one is driving. With respect to the right leg, it can take a little longer, and I'd say 2 to 4 weeks is an appropriate time to plan for prior to returning to drive your own personal automobile.
Sounds great, thank you. Dr. Vicorn, if both of my knees are bad, so how do I know which one to do first? Would that be something that we discuss in the office, or a recommendation from you?
Well, normally we'd take x-rays of both. Referring to hips, on a pelvis x-ray, you see both hips. When it comes to knees, we would typically obtain x-rays of both knees just to kind of see where things stand. In most cases, the knee that is worse on the x-ray is also the more symptomatic for the patient, but that's not 100% of the time. That's not always the case. So in general, we go with the more symptomatic side, unless there was actually damage to the bone that would make putting off the surgery less successful. In general, though, it's the more symptomatic side.
Okay, great. Well, thank you very much. Now, Dr. Burrows, I have a serious question for you. If I couldn't play golf before surgery, can I play golf after surgery? No?
Well, I'd
No,
say
all
no,
right,
but
never mind.
if you're
Well,
eager to get back to playing golf, you will get back to playing golf. In fact, I'd say many of our patients, they have interference with what we call activities of daily living, and we see many golfers throughout the course of a week that really feel that they're having trouble walking a course or even just getting around on a golf cart. And I can't tell you how many patients we've seen that have come to see Dr. Vicorn and myself who have now returned to activities like golfing and are back to living their lives and enjoying the things they love to do.
and that's the goal, right? We want to get everybody back to, their previous lifestyle, playing the sports that they played and without pain. So, yeah, great answer. Thank you, Dr. Burrows. Dr. Vicorn, did you want to?
I have a question. Until we have some more chat questions coming in, I have a question for Dr. Burrows, which I think will be really interesting. Chuck, looking back 2 years ago, a year ago, and presently post-coronavirus, of medically appropriate patients, how many do you think in your practice wanted a go home the same day approach 2 years ago, a year ago, and say last week when you're scheduling surgeries?
I think that's an interesting question. I think 2 years ago, it was hard to convince patients to do outpatient joint replacement because they just assumed they had to come into a hospital. They figured that was part of the process. And I would say 2 years ago, maybe 10%, 15% of patients were interested in an outpatient program. I would say as we've moved through last year into today, and especially in the coronavirus era, I would say a solid 75% or 3 out of 4 patients are very interested in having a dialogue about outpatient joint replacement, specifically in a surgery center where they're not around sick people. I think one of the important things to understand about what Bucks County Surgical Suites offers people is we do not take care of sick people within the walls of this institute here are well. They're screened for infectious disease. If they have a history of serious disease, they can't come here to access care. And we take great pride in the fact that everybody who works here, from the surgeons to the administrative staff to the housekeepers to the nurses, they are all tested for COVID. We really place a strong emphasis on outpatient surgery in a safe environment. And when patients think about that, they are very, very interested in learning more about what outpatient joint replacement is like today.
Sounds
Yeah,
great.
I'd share the same
Great question, Dr. Vicorn.
observation. I'd share the same observation. 2 years ago, it was an extremely high performance patient that would select this approach. And today, it seems like almost every patient would, if possible, prefer to have their surgery and go home the same day. So I asked that question because I'm sure some people at home are wondering if you have to be a 52-year-old marathon runner to qualify for go home the same day replacement. And that's really not the case. Wouldn't you agree, Chuck?
Absolutely. I mean, you can have outpatient joint replacement if you have some comorbidities or some pre-existing medical conditions. But if they're under good control and you're motivated and have good support at home, most of those patients are great candidates to consider an outpatient environment for joint replacement.
Sounds great. Thank you, guys. I do have another question here. This caller or texter is concerned about anesthesia, and she wants to know when would she be able to meet the anesthesiologist and what type of anesthesia do we use? So, Dr. Vicorn, would you like to chime in?
That's a great question. So we're very lucky to have an anesthesiologist team that's extremely skilled in what's called regional anesthesia. So regional anesthesia is where you're not placed on a breathing machine and you receive a nerve block that helps with the post-surgery pain. So intraoperatively, most of our patients have what's called a spinal anesthetic where the legs are numbed, but you're sedated. You don't hear anything during the surgery. And then prior to waking up, a nerve block is performed lower down on the leg, which helps control the pain for up to an additional day. And there's actually a phenomenon when it comes to nerves and pain. If you think about going to a rock concert and the music is blasting and you ride home in your car, your ears ring. But if you wore earplugs to a rock concert and rode home from the car, your ears would ring. If as long as the intensity level doesn't rise to that point that it is above a threshold, you don't have the ringing in your ears. You don't have the persistent pain. And so basically, these nerve blocks, even though they may not eliminate all the pain, they take it down below that level where it's not as lasting, if that makes sense. And so we're very skilled to have an anesthesiologist team that is, we're very lucky to have an anesthesiologist team that's highly skilled in regional anesthesia and also extremely personable and 100% amenable to meeting any patient that wanted to discuss the anesthesia plan. They, in fact, review the patient's cases well in advance of the surgery in case there are any issues that might come up that they want to have addressed prior to the day of surgery, which is excellent.
Excellent. Yeah, and I totally agree. Our anesthesia team is prepared and willing to speak to anybody ahead of time. So if you have questions and or concerns, feel free to give us a call and we'll put you in contact with our anesthesiologist. Dr. Burrows, one of our viewers just asked if they need support at home and would they need a visiting nurse?
Another great question. We like our patients to have support at home, and we ask them to make sure that they have someone available for 24 hours after surgery. Visiting nurses generally are not required for this type of surgical intervention. We do, as I mentioned earlier, have many of our patients receive a short course of home physical therapy. And the home physical therapist, I think, can be a great asset in terms of getting you situated at home and also helping speed along your early recovery. After that first day, though, I don't feel strongly about my patients having somebody at home with them. They can have people that check in on them once a day, and they'll quickly start physical therapy in the outpatient realm. But in terms of nursing care at home, I don't feel strongly that that needs to be provided for the vast majority of us.
Great, thank you. Now, Dr. Vicorna, we have another viewer that's asking, we've talked about how soon they can walk and obviously, how soon they can drive. But as far as going out to a grocery store, do some sort of, activity of daily living where they would be up and about, is there any restrictions or how soon do you see patients going to a grocery store or something like that?
That varies depending on the patient's level before the surgery, but a very rough estimate might be about a month after surgery, maybe 3 to 4 weeks, something like that. I mean, from time to time, you have a patient that tells you they're pushing their lawnmower 3 days after surgery. So there's a wide spectrum, but you could rely on 3 to 4 weeks, I think. And a lot of people are actually able to go back to work a month after surgery.
Wow. Okay. Well, that's great. And it's just a reminder that everybody is different. So one size doesn't fit all. I think both of you would agree with that. And, recovery times and what they're actually doing is really individualized for that patient. So thank you, Dr. Vicorn. I appreciate that. This patient says, I have Humana Medicare. Do I have to call them to have Heal at Home surgery? So Dr. Burrows, you want to answer that question? Humana Healthcare?
So, sure, absolutely. Rather than specifically answer about Humana, and you could obviously call our phone number and we could give you some more information. Every patient that we see in the office setting that wants to talk about outpatient surgery, we will have them sit down and talk with one of our surgery schedulers who is very capable of addressing any insurance questions that may come up and can also help you with contacting your insurance carrier and understanding what costs you may have and also whether your a plan is appropriate for outpatient joint replacement. As Dr. Vicorn mentioned, many patients who have traditional insurance plans have copays associated with their insurance, and the copays in the outpatient realm very commonly are far less than that's seen in an inpatient or hospital setting.
Great, thank you. And again, if, as Dr. Burrows mentioned, call that office, call the doctor's office. You can call them at 215-348-7000. Or we'll put that email back up there. It's contact@bucksortho.com if you have any other questions. I'm going to check with my assistant here. Do we have any other callers with questions? We have one more question coming in. If you have any more questions, please go ahead and send them in to us. What are we looking at here? Okay, how do, Dr. Vicorn, if somebody needs or is concerned about it, how do they know when it's time to have joint replacement surgery? They've had pain in their knee for a while and it seems to get a little worse each year.
Well, one thing would be it should be a level of pain that you have attempted to control with non-surgical treatments. So I wouldn't recommend surgery for somebody who doesn't have a level of pain that it was even necessary for them to take Tylenol or Motrin, for example. A lot of people say, well, I tried them and they didn't work. So it doesn't necessarily mean that you have to be actively taking them, but essentially a level of pain for which conservative treatment is not providing relief would be my
Sounds good.
best
How
advice.
long,
Pain that's daily.
and how long when somebody starts initially having pain to that time when they need surgery, how long is that typically, or is there a typical answer, or is that all
Oh,
across
that's
the board as well?
extremely variable. Extremely variable. I can
Okay.
think of people in the last 4 months that said they had nothing, they felt nothing until 2 months prior. And then for 2 months continuously, it's been agony. And it's very surprising. The x-rays will show bone-on-bone arthritis, and you're scratching your head how they didn't have significant symptoms for a long time with such severe arthritis. But you know, that's one of the amazing things about medicine is the human body is so complicated and amazing and unpredictable that you always have to be prepared for the unexpected. So it can be gradual in some patients. It can be very abrupt in other patients.
Okay, great. Thank you. Dr. Burrows, we have another question here. You know, a friend of a patient or a prospective patient is telling them that they need to go to the city to have state-of-the-art healthcare. What
Oh,
are
boy.
your thoughts on that? And I know, and you know, well, how would you answer that one?
They want
Well,
a
you
student
don't.
doctor. That's what they want.
Yeah,
Student doctor.
I think well, Thomas does touch on a point. When you come to Bucks County Surgical Suites and you see a surgeon like Dr. Vicorn or myself, we're the people doing the operation. We're the people that are in the room throughout your case. We're the surgeons that are putting the implants in. We are not having student doctors or residents or interns working on you at Bucks County Surgical Suites. So that's an important point. Also, Dr. Vicorn and myself are not only generally trained orthopedic surgeons. Both of us completed fellowships in hip and knee replacement at Ivy League institutions. I'd like to say that we're well trained, and the care that we will provide you is as good as you're going to get anywhere in the United States. And we will take great care of you while you're in our office and while you're at Bucks County Surgical Suites. I will guarantee it.
That's great. Thank you, Dr. Burrows. And I totally agree. Just for our viewers, these guys are my family surgeons. So if I were to choose you know, or need orthopedic work or, you know, a joint replacement, these guys are the surgeons of choice. And if it helps, we talked about it earlier. Go to Google, look at Bucks County Surgical Suites, check out the reviews that our patients are saying about their entire experience here at Bucks County Surgical Suites, their experience with the physicians. It's best hearing it from folks just like you, and the Google reviews is exactly that. They're patients who are sitting at home wondering where I should go, who should do my surgery, and they chose Bucks County Surgical Suites and Bucks County orthopedic specialists for their care, and they've been very pleased, and we've had wonderful reviews, outcomes. Our patients are extremely happy. So we would encourage you again to schedule that appointment. Give that number a call, schedule an appointment, ask to speak to, you know, to set up an appointment with one of these physicians. We also have Dr. Boylan, who is not with us tonight, and Dr. Steer, who are both specialists in total joint replacement surgery as well. Any of these surgeons would be a fantastic choice and obviously willing and able, extremely able to take care of you. So I think we have one more question coming in. Dr. Vicorn, how long is the procedure from start to finish? And let's say
it depends on the
yeah, go ahead.
hips and knees are about the same, and it depends on the complexity of how significant the arthritis is. But in general, 45 minutes to an hour, and there's some variation patient to patient. But people are up walking on the surgery on the leg that had the surgery an hour after surgery. It's great. And by the way, thanks, Joe, for mentioning Dr. Steer and Dr. Boylan. You know, it's just Dr. Burrows and myself tonight for simplicity in conducting the chat, but they also are outstanding joint replacement surgeons. And regarding the question from somebody who was considering going into the city, I will say every day I see people in the office who quit the city practices because they are passed around from one person to the next constantly, can't get their question answered, can't get a plan. And that's one of the nice things about practicing with Bucks County orthopedic specialists is the patients see me, we make the plan together. It's very easy for them to understand. If they have questions after they leave, they know who to call back and ask a question to. So I encourage people to reconsider that are thinking about a city-based practice because communication seems to be poor. And that's the number one complaint I hear from patients day in and day out.
Thank you, Dr. Vicorn. And I think along those lines, you know, the center being a small center, we have absolutely fantastic surgeons. We're less than 8,000 square feet, as we mentioned in the video. The entire time that our patients are typically here, from the time they check in to the time that they're home, is roughly 4 to 6 hours. Now, again, everybody's a little bit different, but you know, we have patients that are leaving here 4.5 hours after the time that they check in, and in that 4.5 hours, they've checked in, they've had their surgery, they've recovered, they've done physical therapy, including that flight of steps of 13 steps up and down, as Dr. Vicorn mentioned earlier. And then we help them out to the car. Our patients walk out to the car. We don't roll them out in a wheelchair. You are actually walking out to your car. Our physical therapist works with you, helps you get in the car. We teach you how to get back out of the car and then back into the car. And then we have a visiting nurse that's waiting for you at your home to make sure that you get in safely. So I don't think that you'll find that kind of service at a city hospital. You know, again, I think that what we offer our patients here is state of the art and top notch, and we would encourage you, and we would love to see you here and provide you care. And obviously, it's the end is always your choice. But again, if you have any questions, we feel free, and we would encourage you to go ahead and ask our surgeons, give the office a call, and set up an appointment for at least a consultation. And I do have one more questions here. Actually, it's not a question. Our phone lines are open, 215-348-7000 to make an appointment. So if you'd like to go ahead and make an appointment right now, go ahead and give that number a call. And with that, I'll close out our session. We thank you very much for your time. We value your time just as much as you do. We hope that you receive the answers that you were looking for. And we hope that you take that time to give our surgeons a call, give the office a call, at least consult with one of our physicians. And if so be, then we hope to see you here at the center and provide you the excellent care that you're looking for. So Dr. Vicorn, Dr. Burrows, thank you very much for your time this evening. To our viewers, thank you for your questions and for you know, giving us a little bit of your time, and we look forward to treating you.
Thanks, Joe.